All right. Welcome, everyone. I'm your host, Grace Silverio, for today's Diversity in Diabetes, now Zoom recording. At Diversity in Diabetes, we're all about improving access, outcomes, and representation in diabetes care, making sure that people get the right support in the right way. And today we're going to be diving into a big question: AI and diabetes, helpful tool or overhyped? I'm really excited to be joined by Quisha Umemba, who is not only the CEO of Umemba Health, but also the co-founder of Diversity in Diabetes. She's widely known as the AI translator, helping healthcare leaders cut through the noise and understand how to actually use AI in meaningful ways. She's a registered nurse, a certified diabetes care and education specialist, a public health practitioner, and Amazon bestselling author. Quisha, so excited to have you here. Welcome.
Awesome. Thank you so much. I'm excited to be having this conversation. Also, before we get into it, I just want to say that while I am a registered nurse and a certified diabetes care and education specialist, I have not been clinical in some time, in fact, 11 years. And so I just want everybody to know that I don't see patients. And so I do have some notes. I won't be specifically talking about any products, or I may recommend some apps or some platforms, but I just want to come from that angle, that this is going to be very much outside of clinical care and very supportive. Yes, I do call myself the AI translator because hopefully I can make things simple for you. It seems complex, but hopefully I can simplify those things. So with that being said, I'm ready to jump into this conversation, Grace.
Awesome. All right. So, how is AI currently being used in diabetes care today?
Great question. So I actually love the title of AI is already in a lot of the diabetes devices that are being used. So when I talk about, I'm specifically talking about CGMs or continuous glucose monitors, smart insulin pumps. A lot of apps that are currently on people's phones have been using AI all this time. It's been there, it's been working quietly behind the scenes. You may not have known that's what it was. Just like with my smartphone, it recommends, fitness apps or exercises for me to do on the fitness app, or when I'm watching Netflix and it says, hey, we think you might be interested in this show, right? AI has been around for years, silently working in the background. And so most people are currently engaging with AI and not really understanding that that's what it is. But if you have a tool or a device or an app or CGM or insulin pump, and it is spotting patterns in your blood sugar, it's helping predict whether you may be going low or if you may be going high. And if it is sending insights to your healthcare team so they can make better decisions for you, then that is using artificial intelligence. So many people with diabetes have been engaging and interacting with AI all this time and just did not know it.
So true in our everyday lives, the watches, the algorithms, the Netflix algorithms. Like if my girls want to watch a good documentary, they know that my algorithm has pulled in all the documentaries.
Same. My husband said, you watch the weirdest stuff, but yeah, serial killer documentaries and
Machine
all that.
learning, exactly.
Absolutely. Yes, that is exactly how it works.
That's right. So, what's one way AI could make someone's day-to-day life with diabetes easier right now?
Yeah. So, everybody's familiar with diabetes burnout. And I would say that just reducing that mental overload is one of the biggest ways that AI can make someone's life easier. Having AI tools that can help just reduce some of that to give you recommendations to act on those numbers and on that data, I think is the best way that AI can make daily life managing diabetes easier right now.
That's right. And you already kind of touched on this, but how is AI showing up in some of those tools, more specifically, like a CGM or an insulin pump?
Yeah. So again, predicting where your glucose is headed. If it's heading upwards, trending, then it can automatically adjust your insulin for you before you get too high or before you get too low. It just depends. There are closed loop systems that are already doing this. Now, whether or not you feel comfortable or safe with that, that's, hopefully we'll get into that conversation next, but they've certainly been doing things like that for a while. I would say that the superpower of AI is the fact that it can make predictions based off of data. And so, because it is collecting data by the second, by the minute, it's able to say, okay, it can see the trend of where it's going and be able to alert you to that. So that's just one example of how that's doing. It's quietly doing the math in the background for you so you don't have to worry about it. You just always need to remember that it is a co-pilot. You are in the driver's seat. And so it can't, while it can predict those numbers for you, it can't problem solve for you. And hopefully we'll get into that a little bit later too.
Yeah, I like that. So you touched on it a little bit. How accurate and reliable are AI driven recommendations right now?
Yeah, that's depends on the tool. It depends on how it was trained. It's only as good as the data, right? And again, it's good at predicting based on patterns, but that is not the same as having good judgment. So it can say, your blood sugar is running high or your blood sugar is low, but can it tell you if you slept the night before? Can it tell you that you had chocolate cake because you were at a birthday party the night before, right? Can it tell you, the cultural eating patterns that you might be, eating? It can't do those types of things. So I say it is only as good as the data, which are numbers that's in there. So you want to think of it as a really smart calculator, right? But again, keeping the human in the loop, you are in the driver's seat. You're the one that has to say, okay, it's giving me this recommendation, but I know I'm about to go run, right? Or I know I'm about to go to yoga class. So do I really want to take this recommendation, or do I want to wait and see what my numbers are going to be after I finish my workout, right? So, you still have to problem solve, even though it's going to give you that information based off of the numbers and the data that it is utilizing.
Yeah, that's so true. I mean, look at us today with technology, right? We are expecting Instagram to come through for us and people couldn't hear us, right? So you have to pivot, the art of the pivot. But even with CGMs, having worn over-the-counter CGMs more recently, there is still messaging warnings to make sure that you are paying attention to your symptoms, right? How are
Yeah.
you feeling and actually checking with the finger stick, right? Old school blood
Yes,
glucose meter.
that's right, right. That's right. Because you need those fail-safe measures, right, in place, which is why it's always, I say you need the human in the loop. But you also, when you're managing diabetes, it requires context. And that's why you can't just rely on the number. It's why when you go to the doctor, yes, they want to see your blood sugars, but they also normally have you write down, when we used to, back in the day when I was doing it, we used to have them keep logs on paper, right?
Right.
And so we wanted to see what was the activity? How were you feeling? Did anything stressful happen? Because the number is not the full picture when we're dealing with diabetes. And so there's context, there's nuance, there's lifestyle, there's individualism, right, when it comes to managing that. And that's why we still have to be in control and use AI just like it is. It is a tool. It is a great tool that's going to hopefully give you more information and make you feel more empowered, but it is not a replacement for good sound judgment.
That's right. That's right. So what are some risks that you're seeing or maybe you've heard people talk about on over relying on AI in diabetes care?
I think that's it, just not trusting their instincts. It's giving them a recommendation for a bolus and they're going with that. Like I said, with the ideal of, going to a yoga class or going on a bike ride or something like that. Or, maybe, you're about to go into a restaurant, or maybe, you haven't eaten. And so you do have a low, but you're about to eat right now. And so when you're managing any kind of chronic condition, you know your body, and that internal knowing matters more than what the machine is telling you. So, yeah, you definitely want to take that information, but I think over reliance is going to be a big one. I'm seeing over reliance outside of healthcare, like just using it day to day. And
Mm,
what I will say in over reliance, and I can speak to this personally, there is some measure of knowledge decay when we over rely on it. I remember one day I was actually doing some stuff and I went to write an email and I just like second nature went into
sure.
my large language model and I was like, Quisha, you know how to write an email. Like, you don't need to use AI to write an email. You know what I mean? And so that's what I mean by over reliance. Like, I think it'll get to a point where if you have all of these tools and apps and technology and prompts and CGMs and everything, and it's doing everything for you, is that, and this is my thought process, right? This is what I foresee as a risk. Is that going to limit your ability to problem solve and troubleshoot, right? And just common sense judgment on how to take care of your diabetes. I would say that's one of the biggest things that I would be leery of as we're, relying more and more on these AI tools.
Yeah, I've been guilty of that too, the whole email thing for sure. So how can we create or how can we make sure AI and diabetes care is equitable and we don't widen that health disparity?
That's such a good question. I think this applies just AI across the board. But I will say that one, we have to account for it in the beginning. Equity cannot be an afterthought.
Mhm.
Two, that means we have to have representation from the beginning, right? And the viewers, those that are listening, probably know that Black and Brown people are not represented as well as we should be in clinical research trials, right? It is the same with some of these tools, right? And so if we are collecting data, remember the superpower is it makes predictions based on data. If we're collecting data from a certain demographic, then that means that the treatment and the recommendations that we are giving across the board to everybody may not apply. Okay. So that's one. Two, now representation. I think also access and affordable access. So the people that need it need to be able to access these tools. And if not, it's just going to further widen the gap. I could talk about this topic all day. Actually, it's one of the things that I speak a lot about the most because I do believe that AI is the civil rights issue of the digital era. And I won't go too much into this because I know we're specifically talking about diabetes. However, I do believe that this is bigger than the internet, right? And so when I think about my parents and the internet, turn that camera on so give me light here. There were some people in my parents' generation that either adapted to it or didn't adapt to it. They adapted to computers or they didn't adapt to it. And what happens if you don't jump on a lot of these trends is you're less marketable, right? There is digital literacy that you're losing, and just a lot of what you would expect. You go into the doctor. I have to say this because I have an uncle that just moved from Fresno, California to Texas, and he never used email for anything. He never did any kind of digital anything. He walked into his doctor. And he got here and he was like, Texas wants you to do everything online, everything digital. And I hadn't thought about it because I had to help him like set up stuff and make appointments and do all of those things. And I thought, oh my God, for people that don't have digital literacy, it
Mm,
is a struggle. It's going to be the same thing with AI. It's going to
mm,
be the exact same thing with AI. And the issue here is you've got health literacy, that's one level. You've got digital literacy, that's another level. You've got digital health literacy, that's a third level. You've got now AI literacy. And then in the context of diabetes and managing chronic diseases, you've got AI health literacy. So there's layers on layers on layers of opportunities, and I don't say that in a good way, of
yeah,
opportunities where people are going to be lost, where
yeah.
people are going to be left behind. And that is a real concern that I think is going to widen those disparity gaps when it comes to managing diabetes using AI tools.
Yeah, Quisha, you said so many things that I hope people are thinking about and considering because that is very real. And the literacy and the layers of people that would possibly be left behind. And so, what do you think needs to happen to ensure diverse populations are included in data and shaping these tools?
So I'll go back to representation, right? We've got to make sure that communities that are normally not included in the data set. So I mean the training, the models are trained on information, right? And so right now, most of that is pulled from hospital systems in wealthy urban areas.
Mm,
That means the AI is learning on this very narrow data set and applying it to everyone. And
mm,
so, well, what about communities of color? What about communities that don't speak English, right? What about rural communities, right? Where there's a big access issue and people aren't able to get to the doctor as easy as they would in urban areas. What about low income communities? So, representation, making sure that the data is trained on multiple demographics. And then also, I said it before, designing equity from the beginning. That means partnering with the community when you're actually developing these tools so that you're making sure these things are not an afterthought and they're baked in from the beginning. And that's looking at, community based participatory research or projects and partnerships, whatever that looks like. But doing that is going to help ensure that we are reducing the bias, we're reducing the disparities, and that we're creating tools that are generally going to be more effective for everyone, not just for a subset of people.
yeah, a great opportunity to close some gaps with the rural, the minority, underrepresented, underserved populations, but you have to be mindful. You have to be
Yes.
intentional about being inclusive.
Yes, absolutely. And it's going to take some time. I know right now we in the AI community, we say AI moves at the speed of AI. It's too
Mm.
fast for me. It's
Oh.
overwhelming. It's like, there's been every other month, I'm like, I'm not learning another AI thing. I'm not doing another AI thing, right? And I understand from a business perspective, like for these companies, it's good for them financially, right? To be the first to get out with something
Right.
and the first to go to market, but that doesn't work with a population that already doesn't trust being, exploited or being taken advantage of, right? And so I'm talking about these populations that need to be included in the data. That's going to require building relationships. That's going to require slowing down to build trust. That's going to require being transparent. And that does not equate or go well with we got to get to market. We got to get this out, right?
Yeah.
So definitely some challenges there, but the thing is we're aware of the challenge. We've always been aware of the challenges, right? That's why I get so frustrated. I don't do a lot of these talks anymore because I'm like, well, we know what the issues are. We've always known what the issues
Not brand new,
are. It's
right?
not brand new. When are we going to actually do something and have a talk about the solutions
Mhm.
to these? So anyway, I'm not going to go any, I won't get on my soapbox there, but
I understand. I
yeah.
understand. So, are there any innovations, Quisha, that are coming that people should be paying attention to?
Great question. So I actually had to research this particular question because again, I'm not in the industry like that
Sure.
anymore. I do know there's going to be some smarter closed looped insulin systems that are coming. And so the next generation is not just looking at glucose. They're going to look at things like activity, physical activity, your sleep,
Mhm.
your stress hormones, right? So imagine having a pump that adjusts because it knows that you're in a high stress event. Wouldn't that be freaking awesome?
Wow. Yeah.
I mean, that's exciting to me. AI powered virtual coaching, AI powered tools and apps. As a matter of fact, I've seen a lot. Even I have colleagues, I'm developing one for fertility clients. I have colleagues that have developed them for dementia clients. But what you're going to start seeing, or what I'm seeing, what the literature is showing, is that even though we're using AI, we're coming up with more humane technology. And so when I say AI powered coaching, you're going to have these platforms, large language models, apps, what have you, different modalities that are going to be able to provide personalized guidance and recommendations based on what your situation is. So imagine like it's 3 o'clock in the morning, you wake up, you're like, oh, my blood sugar is this. You want to know why, or you may have a particular question on which way to go. You can't get your diabetes educator at 2 or
That's
3 in the
right.
morning, but you may be able to go to Ada, your AI diabetes assistant or whatever, that name
Right.
is, like I said, I'm building those myself. And
Yeah.
so those are going to be very powerful apps and platforms. Of course, all of the ChatGPT Health, Perplexity Health, Claude Health now, those are going to be major opportunities where people can engage with the large language model to get feedback, recommendations. It's not supposed to be medical information, right? But of course, people, this is where healthcare comes in. This is where nurses like you and I and providers have to actually teach our patients and clients how to engage with it and how to use that data or that the output, the information that it's giving. But that's going to be exciting. I'm trying to think if there's anything else that I researched. I can't think of anything off the top of my head, but that freeing up the clinic staff, the clinic team, being an extension and being able to basically be a provider in a pocket, a diabetes educator in a pocket, because
Yeah.
AI doesn't sleep. It doesn't take time off.
Right.
It doesn't need that. So those are the exciting things that I see happening in AI in general, but certainly in the context of this conversation with diabetes education apps.
Absolutely. I have to make a shameless plug for Verily Health and
Ah,
so something I think that's really exciting that's happening in that space. I've also been not diabetes related, but for people who, for whatever reason in the future, may not be able to drive. I think it's really exciting what's happening with driving, self-driving cars, like the Waymo.
ooh, yeah, I didn't think about that.
That's so
It's
cool.
that's one of those things where it's like scary, but also like cool too. Yeah. But
Uh,
but go back to Verily because I don't know. Like, tell me what's going on with Verily as far as AI innovation. So
Well, so Verily Me it's a direct to consumer. Anybody can go on now and it's free. You download it, and what it does is it, with your consent, very safely, securely can gather all of your medical records. So your historical medical record data, vaccine
yeah.
record data, and you have it in one place where you can easily access. And it is clinician led, so clinician first with AI and an AI companion. Her name is Violet. And
Violet, I love that.
yeah, and so like kind of what you said, Quisha, you have this AI companion that you can ask questions to and is there and always on, right? When it's not convenient, not the 9 to 5 typical brick and mortar hours, right? It's when life is lifing, as I like to say, right? Which is not
Mhm.
always convenient. Life will always win. Life will always win. So it's nice to know that when that question comes up or you forget, you have this, AI companion that can answer some of those questions.
I love that. I'm seeing AI companions in every, like I saw a couple of my colleagues and I was like, let me create me one. So
Yeah,
I love that. I'm going to have to check that out too. So when we want
yeah,
to provide that link or information for people, because that might be very helpful. That's cool.
absolutely. What is exciting you most about the future of AI in diabetes management? Question.
People with diabetes need to focus more on living
Mm,
and less time managing because it's
mm,
a lot.
mhm.
It's a lot. It is, I alluded to earlier, 30 to 50 something decisions more than the average
Decision
person.
fatigue.
Oh
Yeah.
my God, I have it and I don't have diabetes.
Right.
So I can only imagine what life would be like and how someone with diabetes can really thrive if they have a suite of tools at their disposal
Yeah.
that allow them not to have to make one more decision than they have to every day. So what excites me about AI is just the possibility of giving people their lives back.
Yeah.
The constant vigilance, the mental math, the fear of getting it wrong. And so when AI works the way it's supposed to, as it should, I
Mhm.
believe it will absorb a lot of that burden. And so that excites me
Yeah.
about AI and diabetes. Yeah.
I love that. Because even when you think about CGMs, and CGMs have come a long way and they're remarkable. But what do you hear about? You hear about alarm fatigue too, right? So like information overload and people become obsessed with looking at all of the data. So being
Yeah.
able to interpret the data, apply it back in a way that makes sense, and
Yes.
having like a companion that can answer those questions and make the data make sense, I think is going to be really
I
important.
like that. Make the data make sense. I like that a lot. Yeah.
Yeah. If someone's skeptical of AI, Quisha, what would you say to them?
Good. Good for you. 6 months ago, I wouldn't have said that, Grace. 6 months ago, I was like, what do you better jump on this AI train or you get left behind. I
Okay.
always say I'm guilty of spreading the AI gospel. Only, and even though we won't get into like environmental concerns and all
Sure.
this, but I am so concerned about the quality of life disparity from those that adapt to AI and those that don't.
Yeah.
That's what makes me push, like, learn, learn, learn. But I will say, be skeptic. A healthy amount of skepticism for AI is good because it's going to make you cautious. It's going to make sure that you're not over reliant on it. It's going to make sure that you still have your troubleshooting and problem solving skills. We know what problems, that's one of the 7 self-care behaviors, right? And so I will say, if you're skeptical of it, that's completely fine. But also, hopefully, after hearing this conversation, you realize it's probably embedded in so many areas of your life anyway that you haven't even been realizing that you've been interacting with it.
Yeah. So true. So true. What can people with diabetes do today to stay informed and benefit from some of these advancements? Like where do they go? Where do they find it?
First of all, I would say I'm laughing because one of my answers is like, go ask AI. So one, go ask AI. But two, one, I would say explore what you're using right now and see how, if it's in there, probably is, and how it works, or even go to your medical team and see if they're already using it as well. Just you want to be more aware of how it's around you and how you're engaging and interacting with it, right? But then, no, seriously, go and ask AI, whether it's ChatGPT, Cloud, whatever. And I would say I follow industry leaders. So, of course, diabetes educators, there's advocates, there's major diabetes organizations, even pharmaceutical, insurance companies, and certainly tech companies, right? The major ones. I won't say anybody's name, but the big ones. Follow them, follow their social media
Yeah.
sites, sign up for their email, listservs, right? So you can stay abreast of what's going on.
Yeah, absolutely. So, here at Diversity and Diabetes, as you know, being a co-founder, representation and diverse populations are so important to us. How can our community advocate for better and more inclusive
Mhm.
technology?
Well, staying up to par on what's going on, which is what we just talked about, being a voice for the people. One person, two people can't really make a dent, but if a organization like DID is speaking on behalf of the community, then companies tend to listen. When people push back, when organizations push back, give feedback on
Mm,
the apps and devices you use. If it's an app, you can do the feedback on there. You can go to the website. You can certainly go to the social media pages and leave some comments there as well. You want to be respectful. But most of these sites have some type of feedback features or user research. Speaking of user research, sign up for those, especially if you come from a diverse or underrepresented community
mhm.
or population. We talked about how important that is. And ask hard questions. Who is this? You know, who is this? How was this data trained? What was the representation? Who was it tested on? Ask the hard questions. And, there should be no problem getting that information. And a company that can't answer those questions is hiding something, or, they're not above water with their practices. So that's the only way I can think of to say it right now. But ask the hard questions to keep people accountable. And one thing I know about the diabetes community, they don't have no problem asking questions or vocalizing, right? So some of the same tactics that we've been employing, over the years, just as it relates to AI.
Yeah, such a good conversation. I think what we're really walking away with is AI in diabetes care isn't about replacing people. It's about supporting people. When
Yes.
it's used thoughtfully, it can help us personalize care improve access, really meet people where they are with like always on companions. But we still need that human connection, clinical judgment, right? You know your body best. Those lived experiences are really at the center of it all. So, a huge thank you to you, Quisha, for bringing your perspective and helping us cut through the noise. Really thank everyone who joined us for the recording. Again, we apologize for the technical difficulties, but if you found this helpful, please share it with someone in your community. We'll keep having these conversations at Diversity in Diabetes because representation, access, and innovation all matter. See you next time.